Hello everyone. I wanted to make a video and talk to you a little bit about some notes that I've presented for you in the class about exponential growth and decay. So, why am I giving this to you? What does it have to do? And you're probably, as a student, thinking, where's the grade? This really isn't about the grade per se. Of course, there's a lecture participation activity because we are required, both you as a student and me as a professor, to have certain things that we do, like touch points for attendance purposes. So, of course, there's a discussion board. I think you should find that pretty low level, as far as in the brain power. It's a pretty easy grade. You're just participating in the discussion board as it relates to this topic. So, it's really not about the grade. This isn't something that's going to be on the final, but I think it's something that's important because this topic really touches how algebra is used in everyday life, especially in that everyday life of a healthcare professional. So I wanted to present and make some connections between algebra and the healthcare field. And some of you may already be an expert at this. You may know more than I do about this. And that's okay because there's people at all different levels, right? You may be an expert, you may know nothing about this topic, or be somewhere in between. What I find is the value of you listening in and delving into this topic is not just being able to make real world connections to what you do or want to do in the future, but that you also, it might inspire some kind of passion or level of inquiry where you want to research something and find out about it more. Maybe there's a career field you never really thought about. And so opportunities like this, as far as in looking at this topic, really I think could trigger a connection, but also maybe some interest in a field of study. So I hope that you find that to be true. So I'll just kind of go over the what of what I'm talking about, the meat and the bones. So what is this exponential growth and decay? And like I said, there's going to be those of you at varying different levels of expertise in this, and that's okay. We're a mixed bag, right, in this class. So exponential growth and decay essentially is how something's going to increase or decrease. That's pretty straightforward, right? But it's at a rate that's proportional to the current value. So obviously growth is being more, right? But it's not just more, but it's about that snowball effect, about faster and faster. So the more it grows, the faster it gets. Some people say time is like that. The older you get, the faster time goes. The human history is evolving and it goes faster and faster. Exponential decay is the opposite. It's slowing, but it's not slowing at the same rate. It becomes more rapid, but a rapidly slow pace. So if you can think about a glacial speed, right? If you know anything about Earth science, glaciers move, but you're not going to see them move because it's at a speed that's so incredibly slow. And so that's really what exponential growth and decay is at its core in a kind of little common term. So there's so many incredible connections to the health field, to nature, to biology. And so this will help you kind of make those connections, and we think about it in the sense of prediction and planning and treatment. We've all seen movies like the one, I think the most recent in the past couple of years has been Contagion with Lawrence Fishburne. There's been some older movies and other ones that talk about, and then of course we all lived through COVID, right? Um, uh, in the movies or maybe even in real world, right? You've seen this where somebody's at the dry erase board and they're talking about the rate of disease spread. And so that's really what they're talking about is that exponential growth and how it impacts the world as far as in the spread of disease. And that's what you're seeing here. So those folks who say you're never going to use algebra, well, every time they see a movie, they're using algebra if it's about the spread of disease. But basically, what the scientists do or the health professionals do, and maybe public health is something you've never thought about that you might want to explore as a possible career opportunity, is they look at the cases and who has it and how many and what's the risk factors. And that allows them, as the health professionals or the scientists, to make informed decisions about who they're going to quarantine and how extensive this is going to be, and vaccinations and other type of response that's needed. Another application is in medical imaging and treatment. Probably the more common application is in medication, but medical imaging, this is true as well. And essentially, this boils down to how materials are, they have radioactivity. And so the materials, whatever the materials is that's being addressed or spoken about, has a radioactivity that over time is going to change. And so the rate of change is an algebra equation. Of course, we're not going to get into the equations that are used for growth or decay, but just know that it's not just a qualitative thing, right? There are mathematical equations that helps determine what the growth or the decay rate is going to be. And then, of course, that helps with dosing and how often you should take a dose of medication. Now, pharmacokinetics is not something we go around talking about, and that terminology is not too often used. But essentially, if you've seen a good, what I call murder and mayhem show, CSI or something to that effect, where they talk about the concentration of maybe a poison or drugs in the system and how it impacts the body. That's really what pharmacokinetics is, right? The body and the substance and the concentration and the impact. And all of this, again, goes back to that concept of exponential growth and decay. And there are mathematical equations that go along with this. This is just the verbal kind of qualitative connection for you. And then, we all know about bacterial and viral infections. How are they going to spread? What is that rate? What's going to happen? A lot of times with doctors, especially with bacteria or viruses, they have to decide if there's going to be any kind of course of treatment that's going to be beneficial, how aggressive that needs to be, how close do they need to keep a watch on the patient, how are we going to treat the symptoms? All of this needs to be determined, but we have to know what the growth and the decay is going to be of that bacteria or that virus. And then the last is when, you think about cancer research or any kind of tumors. Doesn't necessarily have to be cancer, but tumors and how they grow and what that's going to look like and what's the treatment plan going to be and what's the prognosis. All of that has all of the treatment plans and the decisions are really based on that growth and decay model that's used to determine how a tumor is going to progress. So you can see that there's lots of different, I went very quickly through these, right? But you can see there's a lot of different threads you can pull if you're interested in different healthcare fields. Sometimes we don't know what we don't know. And so I not only wanted to just show you how algebra lives in the healthcare field, but also maybe spark some interest into some other areas that you may want to explore. So again, this was just an exercise in making those connections. That participation activity will get us all logged in for attendance. And I hope that you found some value in making these connections with this topic tonight. So I hope you have a great rest of the day. Again, if you have any questions, I'm always here for you. Just let me know. Bye.